like to start off with words of Dr. Eric Worm, who is internal medicine physician. And his definition of humanism says, it's a twist on a golden rule. You should treat others how they wish to be treated. To me, humanism throughout the experience of my clinical rotation became less of a definition, but more so of a process that accompanies us throughout our medical careers and our life experiences and helps us to build kind and compassionate care for the benefit of our patients.
Humanistic care is important to me as a future physician because it allows me to connect with patients with a genuine curiosity about their lives and who they are as an individual. Seeing my role as not only taking care of patients medically, but helping them through whatever the struggle that brought them into the hospital or office in the first place ensures that I treat them with respect and compassion.
When talking about humanism in my future career, I always try to put myself in the shoes of the patient. You know, you always remember how somebody made you feel, and I think that applies directly to patients and physicians as well. As a patient myself, I want my doctor to care about the things that I care about and not just my medical treatment. And as a future female DO, I would be thrilled if my reputation were that I cared for my patients and that they truly felt nurtured and cared for under my service.
As a future physician in internal medicine, I have the privilege of touching hundreds, even thousands of lives. It is important to me to meet each of my patients' needs and to treat patients and not just diseases. It is important to me to empower my patients to live their best and healthiest lives, and the best way to accomplish this is through compassion, empathy, and understanding their stories.
Humanistic care is important to me as a future physician because I feel like it's really crucial in forming that patient-doctor relationship that's so important when you're taking care of people. They're coming to you, they're really vulnerable, they're scared, they're anxious, they're sick, they're asking you for help. And I think that just talking to them as a human being and letting them know you're also a human being as well really does go a long way in getting to know who they truly are, and just being able to be a better doctor for them.
Humanistic care is incredibly important to me as a future physician in a number of ways. I think the first way is that, I personally decided to apply to medical school for a couple reasons, but I think one of them was that in this career, you really have an opportunity to get to know people and form really strong relationships with them, sometimes their whole lives. You get to know, their families, their values, their cultures, where they come from, everything about them. And I think that's very important in any specialty as a future physician, because it really helps you not only connect with the patient, but improves treatment outcomes. And just to connect with someone on a very deep level like that, I think is something unique to medicine, and it's very important going forward in the medical world when everything seems to be focused on, getting people in and out quickly and insurance and computers and all that stuff. It's very important to keep that relationship.
I realized early during rotations that humanistic values matter. I was rotating for most of the time in Jersey City in a fairly low-income community, and I realized that a lot of these individuals were dealing with pathologies that were rooted in low socioeconomic culture and the fact that they couldn't have great access to care. So I thought that this was of paramount importance, that coordinating care with social work and with other practitioners to enable patients to be able to access care, to help your patient who has diabetes not get to the stage where they have to have an amputation or something more drastic. And I noticed that at my rotational experience, which really opened my mind, opened my eyes about the type of doctor that I want to be.
I chose to enter medicine because of how humanistic the profession is in and of itself. Each day you're bettering the lives of those around you, whether you choose to go into surgery, internal medicine, pediatrics, and so on. For me, I chose the field of physical medicine and rehabilitation, partly because of how patient-driven it is. Each case is unique and devoted to improving individual outcomes of function and improved quality of life. Life is so short for all of us, and we don't know what tomorrow holds, but we do know that we have the power to change the lives of those around us through medicine. And what better way to do that than through compassion and dedication to our patients?
Humanistic care is important to me as a future physician is because I realize how sensitive that conversation is between a physician and a patient. Patients come to you to find cures to their ailments. They come to you as their confidant. They try to tell you things that they may not have told someone before. So by upholding the principles of humanistic care, you might help build a good rapport with the patient, in order to provide the best quality of care for the patient.
Humanism is important to healthcare because ultimately it's realizing that people are more than just their diagnosis that leads to the best care possible. I believe that humanism serves an integral role in every patient interaction. Seeing the patient for more than just a disease brings two people closer together. It allows you to see beyond what lies at the surface and actually investigate the root cause of many of the problems that affect patients.
Humanistic care is important to me as a future physician because I hope to establish trusting relationships with my future patients. As a patient or a loved one of a patient, we tend to remember those physicians that pulled up a chair beside us, took the time to listen to us and help us understand what was happening, why it was happening, and what they were planning to do to help us or our loved one. I know that humanistic care is what will allow me to establish these types of physician-patient relationships, and I know that humanistic care will allow my patients to feel valued, understood, and know that I'm giving them the best possible care that I can.
Humanistic care is important to me as a future physician because it ensures that all patients will be treated with the same respect and importance. Humanistic care takes into account the whole person, which is what we should be striving to do each and every day. As a physician, we have the opportunity to touch the lives of countless patients in a positive way. In maintaining a humanistic approach to medicine, we can be sure to do exactly this.
I was going to see a patient for her prenatal visit. She was late to care and had only one prior visit with a provider she'd already established with. That provider wasn't there that day and wasn't actually going to be there for the next few visits. And when she heard that, as you can imagine, she was a little apprehensive. And she was also apprehensive that I, as a fourth-year medical student, would be starting her visit that day. And in the first few minutes with her, I quickly realized that her apprehension was coming from something else, that there was something else on her mind that she wanted to talk about. And just by kind of introducing myself and putting my notebook down and relating to her as a human, I was able to get her to kind of share some of the things that were on her mind. And that conversation kind of developed into one where we got to know each other a little bit better and even shared a connection on some of our hobbies. And by the end of the visit, she was very willing to be seen by any of the providers at our office, and to my surprise, even asked me if I would be there for her subsequent visits and even on labor and delivery when she was due to deliver. And that whole interaction really truly was so motivating for me because it reminded me of the reason why I decided to pursue medicine in the first place.
An example of humanistic care that I have faced during medical school has been working as the director of a student-run free clinic on campus. As the director of the clinic, my goal is to care for all patients regardless of their background, legal status, or socioeconomic status. I specifically remember an encounter with a Hispanic family that hadn't received care in many years due to fear of being misunderstood and judged in medical offices. And when they came to the clinic, I was able to speak in their native language and understand their barriers and all the issues they have faced in trying to access medical care so that they could feel more comfortable and trust in me. And since then, they thanked me for being able to care for them and understand them on a different level, and they have come back to the clinic many times to continue to receive medical care. And that is just an example of why humanistic care is so important.
So my first real lesson on humanism in medicine was through a volunteer experience I had in San Jose, Costa Rica, at the Children's Hospital of San Jose. And it was through a patient that I frequently visit. He was an infant with a debilitating condition, something that left him paralyzed from the neck down. And every day I would kind of go into his room, practice my medical Spanish and read out loud, make funny faces. And one day I realized that he never had any family that was consistently visiting him. And so I learned from the nurses that he had become a warden of the state. And so the only interactions that he really had were with people like myself and the nurses and the doctors. So one day I was in the room and he was lying on my lap and I was doing the same thing, reading out loud to him. And then suddenly out of nowhere, after weeks of, visiting him and not getting much of a reaction, I saw something that I had never seen before. And he cracked a big, beautiful smile. And I called the nurse over and she came over and looked at him and there it was again. And we both marveled at him because we realized that since he'd been in the hospital, not one of us had ever actually seen him smile. And so I learned from this experience that healing can take on many forms. And it's something that we cannot underestimate, that sometimes our presence alone can do so much for a patient.
I recently had a patient who had a pretty complicated medical history. And I think that he, really just needed someone to listen to him and hear him out. And I think COVID kind of, limited him in terms of access to care, and that landed him in the emergency department. And I think talking to him and sitting down and having a real conversation about what was going on allowed us to access, things that we had in the emergency department to be able to help him aside for what brought him in. And when we discharged him later that shift, he stopped me and he said, I can tell that someone set you on the right path, because I could tell that you cared about me from the moment that you walked through the door to have a conversation with me.
During my internal medicine rotation, on the last day of being on the general medicine floor, I had a patient who was very anxious and very worried. She just was recently hospitalized for COPD exacerbation, and this was extremely traumatic for her. So when I entered the room, rather than asking her what brought you into the hospital, I asked the patient, because I could sense that something was really bothering her. I asked her, "Tell me what's wrong, how can I help you?" I grabbed her hand and I came down to her level, and there she expressed to me how worried and how upset she was. In doing so, I was able to establish a relationship with her, and actually, the patient asked for me the following week, even though I no longer was on the general medicine floor. So the following week, after I saw my patients, I did see the patient until she was discharged, and we had great and funny conversations.
Having survived a brain hemorrhage myself from a ruptured AVM, I was definitely on alert when my preceptor told me there's a young woman in the office with a severe headache and elevated blood pressure. I knew the importance of this patient receiving the most comprehensive care from her physician. So I diagnosed her with pheochromocytoma. However, additionally, I was able to help her address the ongoing relationship struggles, the unsafe living environment, and anxieties that affected her overall health and well-being. She was appreciative that she was more than a diagnosis to me, and that I cared for her functionally, emotionally, and socially. At the end of our last visit, she said, "You're going to be a great doctor. Thank you for actually listening to me." Small triumphs like this, stemming from individualized care, make all the difference for me.
I believe that one of the most difficult conversations that we're going to have to do when we're physicians are the end-of-life care talks. I remember it like it was yesterday. I was a third-year medical student, and one of our patients was being placed on hospice and palliative care because she had a terminal diagnosis. She had about a week to live, and she really didn't have a lot of family in the area. I took the time, I sat down with her, helped her make her phone calls, helped her get her affairs in order. At that time, it didn't matter my title. It didn't matter that I was only a third-year medical student and I wasn't a physician yet. But what mattered was that human interaction. What I remember, even though she had such a horrible diagnosis, she was smiling and she thanked me for taking the time to sit with her, answer her questions, help her get everything together. And that's one of the things that I'm going to take with me forever.
So during my last rotation, I came across a patient who had experienced a stroke and had multiple comorbidities. She was being seen by a multitude of specialists, being seen by nursing, primary, and students like ourselves. One day I went into her room during rounds and I ran into her crying on her bed, and I said, "What's wrong?" And she said, "I don't know." She said, "I went from a person that had total control of her life to someone who has no idea what's going on." And that was the root of the problem. She had no idea what was going on, besides that she had a stroke. So I sat down with her for about 20 to 30 minutes, explained to her, what a stroke is, what could have caused it, what her treatment plan is like right now, what her medications are, what we expect to do for her, and what we expect her to do once she leaves the hospital. Once she kind of understood, what was going on, she was more receptive to her care. She wanted to be more a part of it, was asking a lot of questions, writing things down. And as healthcare professionals, that's what we want. We want the patient to be involved in their care, because once they leave the hospital, a lot of it comes down to them.
I was dealing with a patient that had uncontrolled diabetes, and he was presenting to the hospital in an episode of diabetic ketoacidosis. It was the first time that this had happened to him, and he had forgotten to really buy his insulin for the past 2 weeks because he didn't think that he needed it. And as we know, diabetes is a really insidious condition. So he came in very confused with a blood glucose of over 500. And once we got him stabilized, I had a chance to talk with him about what the endocrinologist had talked to him about and what our team had talked to him about. He really, after a lot of education was exchanged between both of us, and I understood why he didn't buy his insulin, and I kind of gave him the idea of why it's important, he really stopped and said thank you, and really kind of was surprised that I was becoming a doctor in the future. And when I asked him why, he said because I could speak with him. So I really felt like I got to him on a different kind of level than a lot of other physicians had previously. So kind of keeping that in mind for your humanistic care is that when you are able to talk with patients and you are treating them like human beings, you really get a moment where you might get to them in a way that other people hadn't before.
My advice for medical students to keep humanistic care at the forefront of their medical school experience would be to seek out opportunities during the preclinical years that allow you to connect with why you were drawn to medicine in the first place. Keeping your personal why at the center of your medical school experience is going to give you the drive and motivation to keep on pushing and studying when times are tough.
It's really easy to forget why you decided to do this when you're staying up all night and studying, and you're faced with the grueling board exams and all of life's other external pressures. It's really important to stay grounded and remind yourself of why you chose medicine in the first place. And for me, that was through mentorship, that was through volunteering, and more so in my preclinical years, it was about clinical interactions. I needed that face time with patients to remember why I was studying so hard.
So my advice to medical students coming in this season is to take the time to reflect on who you are. Why does all of this matter to you? And what do you bring that is not definable by a degree? Once you can figure that out, let that guide you in literally everything you do. Be genuine, be yourself, and trust that who you are is good enough, and you'll see that everything else will fall into place.
Building a relationship with a patient in general can help foster a positive mindset about the healthcare, industry in general, and, reassure patients that coming to a hospital or to a physician is a safe place and not something to be afraid of. And I think a great way to do that is to, sit down and reassure them that coming in, despite all the barriers they may have faced, was the right thing to do, and that we don't like seeing people hurting or ill, and are going to do our best to get to the bottom of what's going on and get them feeling better, but also offer them resources that they may need aside from what brought them in initially.
One tip I would give to a medical school student is to be an active listener. When listening to a patient, don't just listen to what a patient is telling you, but try to pay attention to the emotional undertone of what the patient is saying, and also the patient's body language. You can actually learn a lot more from a patient by paying attention to how the patient is feeling, and also the body language that they're showing you. In doing so, you can have a better in managing a patient, and also building a better relationship with that patient as well.
Advice that I would give to first-year medical students would be to keep in mind what brought you to medicine to begin with. Med school is going to be really tough. You're going to worry about things such as sports scores and extracurricular activities, but as long as you keep in mind what brought you to medicine to begin with, and do activities that give you exposure to patient care,
and volunteer in the community, you will succeed in everything else as long as you're striving to be a better physician for your future patients.
My advice for a new medical student would be to bring themselves out of the textbooks for a moment and truly remember why they came into medical school and their passion for becoming a physician. The medicine is really cool, but we're all here to take care of the people. And as you remember, as you're studying all night for your exams, it really helps to remember that we're studying to save somebody's life and that we're caring for someone, or we're caring for someone's family member. And that really changes your outlook as you're studying and on your medical education.
My advice for new medical students would be start paying attention to language. Start paying attention to how to break things down into words so your patients and families can understand, because it's a very important skill. Pay attention to the language that we use on rounds. Is it stigmatizing? Do we treat 34-year-old schizophrenics and diabetics, or do we treat a 34-year-old gentleman with a past medical history of well-controlled diabetes and schizophrenia? Paying attention to language early can go a long way.
Some advice that I would give to medical students going forward in keeping these humanistic principles at the forefront of, their medical career would just to be treat everyone like you would want to treat your family member, or you would expect your family member to be treated. We all have a level that we would expect if it was our parents, our grandparents, our siblings, whoever it may be. And I think if you just always go in with that mindset, you'll just naturally incorporate, empathy, compassion, understanding to these patients. And it will overall make you a better doctor because they'll trust you, and they'll be able to open up to you, and you'll find out a lot more about them. And, they're not just a list of symptoms or, a diagnosis on a piece of paper. They're really a human being. And I think that that's always important to remember. And one of the many reasons why I think humanistic care is so important.
I think any advice I would have to current medical students to try and incorporate humanistic care going forward in their education would be to get involved in the community, do activities in the community and whatever projects you like, for the sake of doing good in the community, not for the sake of padding your resume or just putting things on your CV. It should be really because you really enjoy doing things and you want to help others. And I think that will allow humanistic care to kind of shine through in your education and the whole medical school process and beyond.
So the advice that I would give, a medical student that's entering is to keep that in mind. Take on the opportunity to not rotate in the area that most people would want to rotate at. Go to maybe some place that's more low socioeconomics and see how important social work is, how important understanding the social history of the patient impacts the outcomes. Like, there's a reason that low socioeconomic regions tend to have disconnected outcomes, and you think that there's no physiologic basis as to why individuals that make less money should be having more severe cases of disease. But you look at it when you're rotating at these places and you see that it's so much more than just prescribing the medications. It's about getting the patient to the doctor, getting your kidney patient to the dialysis center, figuring out how they're going to get there, if they're a homeless patient, finding a place to live, that type of stuff.
My advice to a new medical student to keep humanistic principles at the forefront of their medical school experience is not to lose the passion that drove you to enter medicine. Whether it be a volunteer experience or a particular specialty of interest, constantly ground yourself to that. Keep a photograph or a memory or a particular thing that always reminds you of why you signed up for medicine in the first place. It's hard, the workload is difficult, and the atmosphere is challenging, but you wouldn't be here if you couldn't do it. Never forget why you came here, and be true to yourself always. What drove you here is what will drive you to stay.
So to the new medical students, it's very important to keep humanistic principles at the forefront of your medical school experience, because we can easily get occupied with getting good grades and building a strong CV. Do things that make you happy and take care of yourself, because when you're able to do that and keep your glass full, you'll be able to give more of yourself and serve others in the community wholeheartedly.
A piece of advice I'd like to give to the underclassmen is to remember your why. Medical school is super hard, and one of the things that really kept me grounded the past 4 years was remembering that everything that I'm learning and everything I'm doing, it does have a purpose, and it's for my future patients. So yeah, best of luck with the rest of medical school, and keep up the great work.
For future students and for incoming medical students, it's really easy to get lost in the shuffle, and it's really easy to get lost in numbers and grades and evaluations. But remember why you really went into this in the first place. You went into this because of the patient, that you really wanted to help people. As cliche as it is, that's why we're all here. We're all here to help another human being.
An advice I would give to the new upcoming medical students would be to think of a time when a physician greeted you very warmly. He treated you more than just a list of symptoms. He tried to find out what was going on in your social life in order to get a better understanding of your diagnosis. And try to embody that physician. Try to think of the kind of impact they had on you. So if you embody that physician, think about the kind of impact you will have as a future physician, the impact you might have not just on the patient, but that one little child that's in the room who aspires to be like you, who thinks of you as a role model. So if you uphold these principles of humanistic care, you will leave a larger impact on not just the patient, but the family members or everyone else involved in that care.
If I had advice for one of my future colleagues entering medicine, I would say don't forget fear. It's easy to see the textbooks and videos and lectures and get immersed in all this knowledge and forget what it's like to actually personally spending time with family, spending time with loved ones, getting to know your colleagues, and really helping each other, supporting each other. Ultimately, it's going to be those strong support systems that help you to realize each patient is unique and how to best address their in the future. It's also important to help to keep you on track and to keep your mental well-being in check.
The advice I would give an incoming medical student to help keep humanistic principles at the forefront of their medical school education is to think about times in their life where they saw a community member, a family member, a physician, or even a friend demonstrate humanistic qualities and how that helped the outcome in a situation and helped to make a positive difference. Or maybe think about those situations where humanistic care was absent and how you wished you could have provided it in that moment, and aspire to be the type of physician who does in their career.
Some advice that I would impart on a new medical student to keep humanistic principles at the forefront is to remember that in medical school, we really focus a lot about the facts. And then you go to rotations and you end up dealing with people, and people do not read the medical textbooks. So when you're thinking about patients that you will care for in the future, remember that these are your neighbors, these are your family, these people are your friends that you're taking care of. And when you remember that these people are your community members, you really are motivated to educate yourself and learn about the best possible treatments that are available and really learn about evidence-based practices so that you can be the best doctor that you can be for the people that you care about.
To any new medical students, to keep humanistic principles at the forefront of your medical experience, get involved in your community and your patient's care. These experiences will teach you so much about yourself and who you will be as a physician. Above all else, be sure to remember why you chose to pursue medicine and why you are here. And hopefully that reason is to make a positive difference in the lives of your patients.
I'd like to remind my first-year students that medical school is the next critical step in a lifelong journey towards joining the most noble and rewarding of professions. You will have the privilege of caring for sick and injured patients who will not only need your expertise, but also your compassion to heal. Hippocrates reminds us that we cure sometimes, we treat often, and should comfort always, and that wherever medicine is loved, there is also a love for humanity.